In a patient with a first trimester pregnancy with cramping or bleeding, an intrauterine pregnancy can be quickly identified at the bedside. To perform this scan, I'll use the curvilinear scanner on an OBGYN preset. With the indicator to the patient's right, we'll start the scan by going in the transverse orientation and really aiming that transducer just above the suprapubic area into the pelvis to identify the bladder. It's very important to first identify the bladder to get your bearings. And from here, we're going to scan from the bladder and then identify the uterus, hopefully just adjacent to the bladder. Once I've identified the uterus, I'll continue sweeping through until, ideally, an intrauterine pregnancy is identified. Early signs could be a yolk sac, but in this one, I can even see fetal heart tones present. Once I've scanned all the way through the uterus, it's always a good idea to do a second axis to go lateral, this time with the indicator to the patient's head, and do another sweep, just to make sure there's even no second gestational sac hanging around with twin B. And once I've swept through, I can feel confident that I've identified a positive intrauterine pregnancy in this patient.